I think we should be good to go. Good morning, good afternoon, good evening, everybody. And very warm welcome to today's expert panel hosted by EthAum Venture Partners. Sleep quality is no longer just a lifestyle metric. It is rapidly emerging as a core pillar of preventive medicine and extended health span. Yet millions of people living with sleep disorders remain undiagnosed, largely because traditional sleep studies are costly or capacity constrained or sometimes difficult to access. And this is why we are extremely thrilled to bring you this conversation, how innovation is scaling sleep testing to improve care and extend health span. Hi, this is Pankaj Gupta from EthAum Venture Partners. We are a healthcare revenue scaler and fund based in Singapore with approximately 120 startups in our portfolio. Today, we are extremely privileged to be joined by an outstanding group of experts who sit at the intersection of clinical practice, technology, and scalable solutions. And this diverse panel is joining from different parts of the world, and they bring diverse expertise on the table to share with our audience today. I would request our panelists to introduce themselves. If I may start with Dr. Chui. Dr. Chui, please introduce yourself.
Sure. My name is Dr. Chui. I'm actually located in San Francisco, downtown financial district. I am also the clinical director at VA Medical Center, taking care of the veterans coming from the government side. So I'm holding two hats here. One is the academic side, one is the private practice side. I also teach a lot at university level. My practice limit only to TMJ treatment and dental state medicines. It's been phenomenal, but I think it's probably one of the best things I explore myself in this area because it's just so fascinating how much dentistry can be involved in medicine side that can make a huge difference. And in this very exciting topic, my practice in downtown financial district is growing really fast, and we are in process of moving to a new location. We are probably exploring one of the first kind that we have a collaboration of different healthcare providers together, including myself. We have the ENT, otolaryngologists, sleep physicians, airway orthodontists, airway pedodontists, upper cervical chiropractor, myofunctional therapists, and all together is to treat is really, really important topics. And I think this is fantastic how this can be a really good platform for all of us to work together as a whole with different specialties together. And I just love the idea.
Fantastic. Thanks a lot, Dr. Chui. I completely agree. When different experts are sitting on a panel like this, there are a lot of ideas that we can exchange, brainstorm, and definitely healthcare is going to improve through multiple different innovations coming from different countries and conversations like this. So thanks a lot for joining us today. And I'm sure that we are going to have a lot of great insights and perspective from your side. Thanks a lot, Dr. Chui. If I may request Dr. Saini to go next, please. Dr. Saini.
Hi, I'm Dr. Vishal Saini. I'm the Research and Medical Director at Midwest Center for Sleep Disorders. We're based in Lansing, Michigan, with multiple locations throughout the state of Michigan. And I don't think I'll be bragging if I said we're probably one of the largest private sleep clinics and sleep lab in our state. And I'm thrilled to be here because we've been on this journey with Belun from very early days with Maggie and Lydia. So I've seen them grow, I've seen them scale, and we've scaled this with them to our patient population. So I'm thrilled to be here and share our experience.
Fantastic. Thanks a lot, Dr. Saini. And because you have been working with Lydia, Maggie, and the Belun team for such a long time, I'm sure you have seen their success, their iterations, product modifications, improvements, and probably some struggles as well. So thanks a lot for joining us today. We are really looking forward to hearing from your perspective. Dr. Lee, please, could you please introduce yourself?
Hi, I'm Dr. Lee Peng. Thanks for inviting me on this platform. Very happy to be here. I'm the medical director of O2 SleepWell Laboratory, which is the first private sleep laboratory in Singapore. I'm also a pulmonologist and an intensivist. My specialty is sleep disordered breathing, So I'm interested not only in obstructive sleep apnea, but everything else that has to do with sleep-related breathing disorders. I'm also a sleep physician, and I actually see beyond respiratory-related sleep disorder, including insomnia, restless leg, REM behavior disorder as well. So we are a theranostic service here. I mean, we provide both the diagnosis as well as the therapy under one roof in this setup, which is the first and only setup in Singapore. Happy to be here to interact with all of you.
Fantastic. I know that you are extremely happy. This is 11 p.m. in Singapore and you are joining us for this conversation. I'm sure you are thrilled to be part of this. No, thanks a lot, Dr. Lee. It shows your passion on the topic and, really looking forward to learning from you. I hope you have a coffee with you available.
No coffee.
You don't require a coffee to have a conversation on this topic. Fantastic. Thanks a lot, Dr. Lee. Last but not least, we have Lydia, founder and CEO of Belun Technology with us. Lydia, please introduce yourself.
Yeah, thank you, Pankaj. I'm Lydia, as briefly introduced by Dr. Saini, has been working with these medical wearables and the AI since 2016, which is back in 10 years ago, since we've become the first one to deliver the FDA clear ring that can be used for continuous SpO2 measurement. And then that's how we further develop the AI together with the research throughout the world, including the US and Singapore. And in 2023, that's when we get the FDA clearance for both the ring and also the AI, and such that it can be used for the home sleep apnea testing. And that's how we start our journey in the US and start to grow together with Dr. Saini, Dr. Chui. And also, of course, in 2024, we finally get the approval in Singapore, and that's why we deploy our system and platform in the whole Southeast Asia as well. And so we are very fascinated about this area because sleep is not only sleep itself, but it is highly correlated with all different kinds of chronic disease management. And of course, recently it became a very important element together with stress in the longevity journey. And so we are very happy to grow with all the specialists from sleep doctors to dentists and also even recently with cardiologists. Yeah.
Thank you. Thanks a lot, Lydia. Building a healthcare product, building a healthcare startup, and then growing it to this kind of stage is not easy. And you have done all of it. So I'm sure that you have seen a lot of challenges while building the company. And we are really excited to learn from your perspective as well. Together, we will explore how innovation is removing barriers to accurate, accessible sleep testing and how that progress can unlock better preventive care and longer, healthier lives. Again, thanks to all the panelists for joining us today. And now let's get into the insightful conversation. Let me start with the very first question about the wearable home sleep test landscape. So we have so many different kind of solutions in the home sleep test landscape, but the wearable HST is emerging as a new entrant. How do you think the wearable HST is changing the overall home sleep test landscape, and where do you see HSAT heading? What is your opinion on that? And I would request Dr. Saini to start with his insights on this overall HST landscape first. Dr. Saini, please.
So that's a great question, Pankaj. I've been doing sleep medicine for more than a decade now, and I've seen this landscape evolve. I remember the days when home sleep test was very cumbersome. In fact, I've also seen days when there was no home sleep test. It was only in-lab sleep studies where you would spend a night in the sleep lab for any kind of, even if there are people who are at high risk for sleep apnea. You would look at them, you look at their medical history, and there are tools that could predict that, hey, you have 60, 70, 80, 90% chance that I'm going to find sleep apnea if I test you. So then the in-lab sleep studies were getting so constrained because the pipeline, building a sleep lab, as Dr. Peng has probably, he's a new sleep lab he just opened, can be very challenging. It's very expensive. In fact, before wearables came, even home sleep test was very expensive. So there was a lot of cost barrier, a lot of personal barriers, a lot of wait times were incredibly high. Where, hey, I'm waiting 6 months, 12 months just to get the test. Forget about the treatment.
Right.
So that's where, the evolution started, where, hey, could we figure out a way to bring this testing closer to home, which is easy to do, easy for patient to perform at the home, and then the results are easy to understand and interpret. So this whole notion that we need faster turnaround times for all of this, because the magnitude of the problem is big, and I'm sure you'll touch that on our discussions as to what is the magnitude of obstructive sleep apnea that we are dealing with. By some estimates, there's almost 1 billion people on this earth with sleep apnea, and no amount of sleep testing can easily figure that out. So obviously we have to have ways and means to scale these things up so that we can easily diagnose and then obviously treat these patients. So the home sleep testing went from all the sleep testing be done in the sleep lab. Then there was the first generation of home sleep test devices that came around, which are more, they're trying to sort of mimic parts of the in-lab sleep testing where, hey, I have a belt on my chest with a recorder, I have a nose cannula, and I have a pulse ox on my finger or my wrist. And then, you would go and analyze the data. Majority of it was done manually, some of it, as the technology has progressed, now a lot of that has been taken over by AI as well. So then came the wearables, then came the technology that made Belun possible, which is based on PPG, very similar to how a pulse ox would work, which I'll have Lydia explain because she's the pro on this, as to how that works. But what wearables have done is they've shrunk that whole setup to just the size of a ring. And suddenly it made the testing very, very attractive for the patients who were always either refusing to come in for the sleep study just because they didn't want to sleep in a strange environment, or they were just always anxious as to, oh my God, will I be able to sleep better? So wearables took care of that problem. It's much easier to deploy. It has brought the cost down, and it has reduced the wait times for both the providers, physicians, clinicians, and patients as well. So, it's almost like a triple effect from the wearables where it was able to tackle all these multiple challenges at the same time. And I think that's probably why it makes it so successful.
Right. No, fantastic, Dr. Saini, and you have a lot of experience and you have seen the evolution of HST in the US market. But let me also ask Dr. Lee, what is his experience from Asia, especially Southeast Asia market? Dr. Lee, please.
Hi. So in Asia, the waiting time for a polysomnography in a sleep lab is equally grueling. 1 year, yeah, you will not be surprised if the waiting time is up to 1 year and even 1.5 years. So the last thing that you want is for a patient to wait 1 year and end up that the patient cannot sleep on the night that he's being scheduled for the test. So which is why where home sleep testing comes in, and we are pretty slow in adopting home sleep testing, probably only the past of 3 to 5 years. And we started with respiratory polygraphy type of devices as well, like the Alice Night One, as well as the ResMed Apnea Link. So then after we progressed to PAT devices and then subsequently to Belun ring, definitely this increased the patient's comfort. It allows us to test the patient at a place which is usual to them, which is comfortable for them, at a time of their choice. Like even if they are shift worker, we can test them as well. Yep. So this is where HST comes into the picture. And now when we have access to even more accessible to HST that's as convenient as balloon ring, what we can do is we can actually test the patient using the balloon ring for a few nights prior to their polysomnography in the lab. And in a way, we will have multiple night of sleep testing with HST forming the first few nights and a final testing of polysomnography. So we have representative view of the entire spectrum of the patient's sleep over a few days.
And let me also get Lydia's input on how the overall technological innovation, or especially AI, is evolving this space. Lydia, what is your perspective on how AI assisted and AI has assisted in healthcare, and how to make smart use of technology, especially when it comes to HST? Lydia, please.
Yeah, for the HST, firstly is, as the doctors has shared, is provide the comfortability and it provide the advantage of multiple nights, which will not be allowed if it is a in-lab testing. Okay, and together with the AI, I think the major advantage is that it can come up the report very quickly. And also, we can allow we still allow the option for manual scoring, but very quickly we can come up with the report and at least to see how severe is the patient, as a very cost-effective way. And more important is now is not only using for the deployment of the diagnosis, but also very important is how we can allow patients during their treatment. We can also further collect the information for the post-treatment monitoring, and finally, how to optimize the treatment in a very short period of time. With all this plotting, we can get the patient involved in the process and such that they can more adhere to the treatment. Because as we all know, one of the issue of sleep apnea is not only in the diagnosis, but more important is when patients get diagnosed, how we can get them to adhere to the treatment, and how we can allow them to choose different treatment and show them that, wow, this one is as effective as this one, but your stress level is much lower and more comfortable. So maybe this is more suitable for your treatment. And visualizing the treatment efficacy is also another major advantage. And of course, recently we are also on the way is making of AI and all the data to see how we can, just based on data, we can find out and figure out the most appropriate treatment for the patient as well.
Fantastic. So what I understood is that this is not a localized problem. The problem that Dr. Saini sees in US is pretty much similar to what Dr. Lee sees in Singapore and Southeast Asia. And wearable HST have definitely improved the overall convenience, cost efficiency for the patients, for the doctors, medical professionals, and so on and so forth. So that definitely this is a very interesting and important evolution which has happened in the overall sleep test and HST landscape. Thanks a lot for your insights. I see Dr. Chui has been patiently waiting for his turn. Now let me get his input on, dentists are uniquely positioned to help identify obstructive sleep apnea. When I started learning a bit more about OSA and HST, I thought, why dentists are involved into sleep apnea? But now I understand how uniquely you're positioned to identify, to understand, to diagnose, and so on and so forth. So, Dr. Chui, from your perspective, how do you see the collaboration between physicians and dentists in the HST space or in OSA space? You're on mute. Let me unmute you.
Okay, can you hear me?
Yeah, please.
There's something that's very, very important, I think, in my whole dental career, that the more I look at it, the more important I think how this can be so undervalued in terms of many, many different side of medicine. My wife is a neurologist, and it took me a while for me to explain it to her, to talk about her, to understand what I'm doing. This is why finally now the government realized how important it is, so we can implement this for the whole veterans situation, how we can treat them so much better in a non-surgical way, to eliminate medication as much as we can because we are really looking at someone from head to toe. We're not just looking at the airway, looking at every single joint in the body, how we can improve the patient's quality of life and potentially can help increase the lifespan and also the health span. When you look at the whole body, the most vulnerable area, the soft tissue is always the airway. You have heart tissues here, heart tissues there. And this is fully controlled by one thing that people don't look at is the jaw position, the joint collaboration between the most sensitive cranial nerve from the brain, the trigeminal nerve. A tiny little foot trap between the teeth and the gum, little cavities drive you crazy. Imagine all these are not comfortable in here. The brain's gonna fire up with sympathetic nervous system activations. The key is how can we calm everything down to balance autonomic nervous system? The dental components plays a huge role on that. And it's really important how we look at everything from the beginning of the spine, which is the temporal mandibular joints. When this is in a good position, the whole body is gonna help balance it back. So if you can ask Maggie to put the picture that we can show it to everyone. Now, this is the body and how the whole body align together. When you really look at the temporal mandibular joint to the upper cervical area, this is the major area that a lot of cranial nerves coming from the rest of the body to in touch with the trigeminal nerve in anatomy, in neuroscience. And all these are fully controlled by one of the most powerful mechanisms in the body, which is your teeth in the jaw. Teeth produce thousands of pounds. And this affects so much that brain knows something is wrong. When something is not happy, it's not right, they try to figure out a way. And that's why when patients are under a lot of internal stress, you're not breathing well, not getting enough oxygen, you're under a lot of chronic pain, a lot of stress, the brain would tell you to grind your teeth. Something is not balanced in the jaw, and that activate all these muscles around the whole body, primarily around the airway. Now, a lot of times we treat the patient with oral appliances and also the TMJ treatment. We actually treat them as both things at the same time. Many times when we treat the patient TMJ issues, AHI always goes down. It's not because we are protruding the jaw, because we're making patient healthier, making patient feel comfortable so they can breathe on their own. So this is something really important, how dentists are uniquely positioned to help identify OSA, because so in my practice, most of my patients are referred by physicians. So I work really, really close with a lot of physicians, such as sleep physicians, PCP, pulmonologists, neurologists, ENT, and all the professionals. They refer to me for evaluation on management of oral appliance therapy for sure, as well as with other related concerns, such as involving the airway, craniofacial anatomy, jaw function, and TMD. But the referral process is not one directional because we also refer a lot of patients back to them as well. And these two referral relationships is the foundation of how we can make dental sleep medicine or sleep medicine effective. Dentists are uniquely positioned to identify this OSA issue because we see patients a lot more regularly than many other healthcare practitioners. We see them every 3 months, 4 months, 6 months. And during the dental exam, we can identify a lot of other issues that a physician may not look at. And we look at the crowding of the pharynx and oral area, the enlarged skeleton and the narrow dental arches, mandibular retrusions, and the tongue space, and mouth breathing, dry mouth, grinding on the teeth, fractured teeth, and all these are something that we look at day in and day out. But this could be symptoms of TMJ issues and sleep apnea. And sometimes we ask the patients, oh, do you snore? Or has anyone witnessed you stop breathing? Or do you wake up and then refresh? And do you experience daytime sleepiness and all that? However, it's very, very important to be very clear. Dentists can screen the OSA, but we cannot independently establish the diagnosis. That's why we need to work with physicians. We identify the patient at risk, we communicate our finding and refer the patients back to the physician to help us to diagnose. And it's a beautiful system. The physician evaluate the patient's medical history and comorbidities and determine the appropriate with sleep tests, interpret them, and establish the diagnosis and help determine the appropriate treatment options. And if the physician determines that oral appliance therapy is appropriate, the patient is referred back to us. And when we evaluate the dentition, periodontal support, occlusion, and mandibular range of motion, and how we can evaluate the TMJ can help the patient feel a lot better. And the whole goal is eventually how can we help the patient relax the muscles, also work with the ENT, open the nasal, the patient can breathe on their own. That really creates a closed loop system rather a simple handoff. And the collaboration is very important because treating OSA involves more than just selecting a device. The physician evaluates the patient's health issues, medical history, and also for us to evaluate the jaw joint, the teeth and dental and the airway. And together we can choose a treatment plan that's medically effective and physically sustainable. And this becomes even more important when patient has both OSA and TMJ issues. And that's how we come in play in this position because all the whole time we try to manage everything, we need something that's more definite, the titration number, the data, and all these eventually we can see a really objective data to see how we can make patients feel better. And I'm so excited about the AI data that's going to come in. I'm in the area that we have so many AI companies in San Francisco. We are within walking distance with Anthropic, OpenAI, Databricks, Scale AI, and Perplexity, and they're all a lot of them actually my patients. We talk about all these and how much we can. It's just the sky's the limit. It's so much we can do, and this we are just scratching the surface. I'm just so happy to see all these that's happening. And I know that now there's slowly more and more people are recognizing dentistry plays a huge role to collaborate everything together. And it's just something that I think I make the best decision to transform so myself from a regular dentist, general dentist to be a little bit more like a medicine side to help to target this really important topic in medicine.
Fantastic. So your role becomes even more critical for the overall health and lifespan of patients. So what I understood is that the multidisciplinary collaboration is extremely important, very critical to identify OSA and treat OSA. And when the data is coming from the wearables, the AI models are being built by the wearable companies and so on and so forth, it becomes even more interesting because you have the data on which you can rely and treat patients better. Now, let me ask Dr. Saini as well. Dr. Saini, have wearable improved multidisciplinary collaboration from your perspective? What are the other benefits that you see because of the wearables in the multidisciplinary collaboration? Dr. Saini, please.
And short answer is yes, it has. And not just for dentistry, there are, several other specialties that, as a sleep medicine physician, we collaborate with. There are several that haven't caught on, they haven't, caught up with the time. So, for example, we don't really see a lot of patients being screened by nephrologists yet. We know obstructive sleep apnea has bigger impact on kidneys, but nephrology hasn't caught up with that trend yet. Cardiology, on the other hand, is big on sleep apnea testing now, and they screen because they realize that hey, it has a huge burden on the cardiovascular health of the patients. So, all these different specialties, for example, oncology is sort of behind in the game, I believe. And we're realizing that there is so much, even the timing of medication that you take, the circadian timing could impact your patient. And how does putting someone on chemo or radiation is impacting their upper airway anatomy, and is it causing more sleep apneas for the so there's like Dr. Chui was saying, hey, sky's the limit with this thing, which is so true. But what it has done is, for example, I'll give you a real life example from a dentist's perspective, where we send the patient, we tested them, we diagnosed them with obstructive sleep apnea, and they're not interested in dealing with the PAP therapy, which a lot of our younger population, a lot of our women population, they don't think, PAP therapy is very conducive to whatever else is going on in their life. They might be traveling, they might think it's not as attractive to their partner. So then they're looking for, something that's more easier to deal with. And so then we said, okay, we'll send you to the orthodontist who practices dental sleep medicine. And then, once they get titrated, put on an oral appliance, a lot of dentists have incorporated using this wearable technology to assess the effectiveness of where to stop the titration, how far more I gotta advance. Same thing is happening with even PAP therapy, where, hey, if I'm questioning that your numbers look good, but patient keeps coming back telling me I'm not feeling rested, I'm not feeling any improvement in my symptoms, then we could easily utilize this home sleep testing to get a little window on, okay, what I would, ask Lydia and Belun to hopefully provide is some good steady data that pitches, Belun results versus what we're getting on the CPAP download reports. Because a lot of these CPAP machines, they're telling us that, hey, the patient sleep apnea number is 0 or 1 or 2 per hour. But then when we do the home sleep test and we're finding that that may not be true. So that is I think one thing that needs to be resolved, and I think Lydia, that is going to fall upon your shoulders to provide that sort of data that, hey, because and I don't think I'm wrong in saying that as a sleep physician, people have way more faith on the data that's being delivered by the CPAP machine. So when I look at that, I have to questions like, okay, which one is correct? And then sometimes to resolve that conundrum or confusion, I gotta bring them in the sleep lab to figure that out. But that you can see how this thing can escalate, right? So yes, we have this technology that is easily accessible, making everything super easy to do, very fast turnaround, rapid results. But just like any technology, it can be used for a lot of good in good hands and people knowing what they're doing with these devices, but it can also take people or patients down a very downward spiral of more and more and more testing, or more and more and more worry. So I think it's important when you are selecting, for example, Belun, or for that matter, any home sleep test, to actually dig a little bit deeper as a clinician. Okay, what are the upsides of this test? Which patients is it going to work the best? Which patients I need to be a little cautious about these results? Because at the end, AI is AI. You can't just put a blindfold and just believe completely what AI is throwing at you. We're not treating the report that Belun is giving us, right? We're actually treating the person sitting in front of us. So you have to listen to them and then put all of this into perspective and create a treatment plan that's actually helping them. And so sometimes we get so intensely bogged down by numbers. We're in the era of finding a number and putting a number on everything, right? All my patients show me their watch and it's like, okay, my sleep number was 100, I'm doing great. It's like, okay, did you really need the watch to tell you if you're doing great or not? What is your own opinion? Are you doing
Right.
great? So you have to be aware of what are the strengths of the technology that I'm using, and what are the weaknesses, because without that you're not providing a good service.
Fantastic, Dr. Saini. So what I understand is that while dentist department has caught up, there are friends over nephrology and oncology department that need to be that need to bring up to speed, and that need some education. So thanks a lot for that recommendation. If there are oncology and nephrology specialists listening to this conversation, they'll definitely come back and talk to you on this. But I understood that while data and AI is good, but it can only make recommendations. Ultimate decision sits with the doctor, with the professional, and they need to treat the patient. So they have to make the decision, what is right, what is not right. So thanks a lot for that. Let me bring Dr. Lee and Lydia on, again, multidisciplinary collaboration. Have you seen specialists from other department, not dentists, from other department, collaborating on identifying, treating OSA in your experience, or do you think that they are still far behind? Probably Lydia or Dr. Dr. Lee, whoever wants to go first.
Yeah, maybe Dr. Lee first.
Yeah, I just need to backtrack a bit with regards to what Dr. Saini has mentioned. Absolutely true. The nephrologists are probably quite behind when it comes to screening for obstructive sleep apnea. And interestingly, they actually have the best windows of opportunity, especially for patient on hemodialysis, because this patient will spend 4 hours in their office, and this will be the best opportunity for them to be screened. And I actually did so for using Belun ring when I visited a dialysis center, when I'm looking after one of my patients who's having dialysis there. And yes, so I think we should educate the nephrologists, and definitely they are looking at a population of patients with very, very high prevalence of obstructive sleep apnea and other forms of sleep disordered breathing. And to the question of oncologists, also initially I was a bit hesitant when I look at oncologists, those cancer patients, and I was thinking probably with limited time lifespan, to put them on a mask and to get them accustomed to the mask is probably not going to be easy. But the same thing, I have several oncology patients who changes my opinion of that, and realize that it actually vastly, drastically improve the quality of life and however much lifespan they have left. So I think this is very, very important as well. And thanks for bringing this up. So these two groups of patients, we have to work on them. As for your question as to which other groups of the specialists we are working with, so cardiologists are definitely the number one group. And also wearables to them, it's all started from the Apple Watch picking up atrial fibrillations.
Right.
And thereafter, we have floods of patients with atrial fibrillations diagnosed by the cardiologist being referred to us for further testing. Yep.
Fantastic. Thanks a lot, Dr. Lee. Lydia, please.
Yeah, I do echo what Dr. Lee has mentioned. It is quite interesting. We do have an interesting case is also a patient with dialysis, and he is also using the CPAP machine already. But finally, he never thought that while he feel very tired. But then after he used our ring at home, because in Hong Kong, we do allow patients to own the ring to monitor at home. And when we look into the number, we see that, wow, with the use of the CPAP machine, the patient is still a severe patient. But finally, what we figure out is that, maybe you need to bring the reports back to your kidney disease doctors. And what finally he need to do is not only the CPAP machine, is he need to increase the number of dialysis frequency, and such that they can minimize the amount of water inside their lung, and to reduce the situation. And we do see that in the long run, it's very important. It's not only on the diagnosis. And that's why we are working very hard in working on the platform to facilitate all kind of specialists such that they can work together. And they can visualize the data, they can fine-tune different parameters, and not only the doctors can visualize everything. Very important is we also empower patients to visualize what is happening and how this is helping them, and such that it will become a bi-directional communication between patient and also doctors. And also we can give them not only AHI number, but multiple parameters to let them understand is the overall improvement in their feeling. It's not only the lifespan, but health span. And it's not only a feeling, because before it's quite subjective. I feel better. But what do you mean by feeling better, right? And just Dr. Saini say is sometimes we may not be the best to reduce the AHI to 0, because this may increase the stress level of the patient during sleep, and they may wake up quite often because of the dry mouth. And you can fine tune the number to see that, wow, the patient is less stressful when they use the CPAP machine, but the AHI maybe residual is still 2 or 3. But does that matter? No, because below 5 is probably maybe good enough. But if he or she can much more compare to the treatment And that's the best. And just like the titration, and that's how we can help dentists to expedite the whole titration process from a few months to a few weeks. And this is not only good to the patient, but good to the dentist, because overall it is an experience to help to optimize the treatment and encourage the patient to take action. Because before, when you tell people, oh, if I get diagnosed, the only option that I have is just wearing a mask. Then they don't even want to test because I'm not going to wear the mask even I get diagnosed. But now if I have other treatment like oral appliance, like surgery, or even medication for obese patient, then they will have a more willingness to step out of their comfort zone and to take the action.
So, Pankaj, if I may,
Please.
Lydia, do you foresee, the Belun coming up with let's say, Belun Light, which becomes an over-the-counter device that patient could just go to Walgreens and buy a device and track, and it's not gonna give them, the crazy details that we need, but it might just give them some solid numbers. Do you foresee that happening in some market?
So, Lydia, a good partner not only appreciates you, but he also gives you a lot of interesting ideas and areas to improve. Go ahead, Lydia, please.
Yes, definitely. I must say, throughout the whole journey that since we found Belong, we do get a lot of good suggestions from our end user and who finally also become our investor. And yes, we are coming up another version and very soon, and to stay tuned. And we will have some simplified version, and that after the patient use it in the clinics, then probably they can own one, no matter it's through Walgreens or probably through the clinics, and that they can carry back home, and such that we can encourage people to be more compelled to their treatment. Yes, we are on the way on doing that. Yeah, especially
Good.
because we know that sleep is a very, very important element in the journey of longevity and the health span of people, right? It's not just about the number, but it is a very important element together with the stress, because before we may look into whether people have hyperplasia, have diabetes, but now you can see all this is affected in return by the sleep. And we recently just published an abstract in sleep is that you can see how people poor sleep is not only OSA, but also insomnia or PRMS, is that how lead to the fluctuation in the blood glucose level when people wake up. And so this is a very important, but before we lack data, because we just have one line of data, how we are going to conclude. But now, as Dr. Saini said, we have very long-term data, especially medical data, together with medical history. This is how we come across all this together with the function of AI to have prediction and to also have useful tips, but not just make the patient worry, but useful tips to let them know, oh, maybe today you eat less sugar, or today you need to be more relaxed, and because based on yesterday, your sleep matrix. And this is how we think sleep in the long run will play a very important role to keep people healthy.
Fantastic.
Well, we
Thanks
would
a
love
lot.
to pilot that.
See, this is the beauty, Lydia. You haven't even launched the product, but you have customers ready. Thank you, Dr. Saini. You are the earliest adopter. But Dr. Saini and Dr. Chui briefly touched upon data and AI, how these two things are so important for the patient journey, for the treatment, and so on and so forth. But let me ask Dr. Chui from the dental practice perspective, how does objective data or AI models improve overall patient journey in integrating sleep testing from dental perspective, please?
Yeah, it's extremely important because I mean, I think you guys have hit the head of the nail really, really well earlier. When you do the sleep test, you just record at night. We need a whole picture.
Right.
Like if you want to watch a movie, I always tell my patient, if you want to watch a movie, it's a comedian movie. In between the whole movie, some scenes gonna be crying, some scenes are upset or angry, but at the end it's all happy. But if you screenshot that part, it doesn't tell you the whole story. You need to watch the whole movie. That means you need a multiple more data to come back together to summarize and give you the real problems that you can see there. So that also requires the AI and also the data combined together. One thing I'm truly and personally in my more subjective opinion is I think the home sleep test for the function that you can record the oxygen level, eventually this will be the main push of how we can help the sleep world to kind of transition from what we just looking at AHI as a number, individual as how many events per hour, slowly transition to something that's called more important hypoxic burden. This is the real number that we can find out how much it affect our stress level and how much it has the real impact on our body instead of just looking at how many times. And that's something I think by pushing the home state test with the desaturation number, that can really help us to establish a new gold standard of looking what's the medicine is going to be in the future. And combined with the AI, with the numbers again, how we can picture everything together, I think it's going to be really important. Now, for us, US is probably been a little bit more mature market that we use home sleep test for a long period of time. And this is the main test that we test right now for patients. But this is going to be really great because we get a lot of objective data, changes from the conversion from we being suspicious to measurement, how AI can help us transform a large number of physiologic information into something that the clinical team and the patient can understand and act upon. Now, in the dental setting, patients frequently report snoring, fatigue, morning headaches, grinding, jaw tension, non-restorative sleep, and these symptoms alert us of possible problems, but they cannot tell us what actually happened and physiologically and during sleep. But objective testing helps quantify the respiratory events, oxygen desaturation, hypoxic burdens, the pulse rate responses, the sleep times, the sleep stages, and also even the body position and night-to-night variability depends on all the capabilities and validated use of the device. And the AI will improve this process in several very, very important ways. It makes complex sleep data a lot more efficient to analyze. And medical wearables may collect thousands of data points, but it's so complex and so many different layers. And validated AI can help you identify the patterns, detect the class and classify potential events, estimate the sleep and wake periods, and organize the information into a clinical useful report. This will allow the medical team to review the patient's sleep more efficiently while preserving the needs for professional interpretations. Now, also AI and objective data makes the condition a lot more understandable to the patients. And patient might have been told for years they snore, but seeing repeated breathing disruptions, oxygen fluctuations, the pulse rate elevation, and all these issues. We can show the patient, say, for example, how frequently breathing disturbance occurred, how deeply and how long oxygen level falls and fell, whether the condition was worse during sleeping, patient sleep supine position or side, whether certain portion of the night were affected, and how the cardiovascular autonomic nervous system responded. And that really helps me with the complicated part of when we try to treat a patient with mandibular advancement device. Now, what are we looking at is not just a number, which device can we use the best? What protrusion level potentially can set up when we first started. All the data, where is the job position, patients have a lot of other autonomic issues. AI can come in and really help us to recognize these complex patterns and may eventually support a more personalized understanding of the patient's OSA phenotype. This can help us move away from traditional treating every patient with the same AHI as though they might have the same condition, but they might have very different conditions. And objective information can make the oral appliance titrations a lot more precise. We should not just advance the appliance based on whether the patient is snoring less or improving the snoring or daytime symptoms, but it does not necessarily mean that the respiratory condition is adequately controlled. During titration, we can evaluate different things like what is the objective respiratory response, what is the patient's subjective improvement, and also the dental musculature and the TMJ responses. And all these can identify the minimum effective therapeutic position, that the position of the jaw that provides meaningful respiratory improvement while remaining comfortable and sustainable for nightly use. And more mandibular advancement is not automatically better. Some patients respond in very different ways of just by moderate advancement, while excessive advancement might increase muscle tensions and TMJ symptoms, and patient is going to fight you. So in return, the jaw, you can open as much as you can, but the patient will fight you and then they would not feel comfortable to want to use it. And the multi-night wearables also testing can provide a lot more representative data a lot better. The OSA severity may change from one night to another, and all these can be summarized and analyzed by the AI, which is very important for patients with borderline findings or results that do not match the symptoms. The guys talked about earlier that if someone the AHI goes back to 0 and 1 and 2, why patients still not feeling better? Now, this could be something we're looking at right now. It could be upper airway resistance syndrome, which AHI is really normal. Can we use the sleep test to determine that how this patient responding for the autonomic nervous system, or patient have other issues that we are actually looking at so much that I know the upper airway resistance syndrome highly correlated to TMJ issues. That's how we look at the situation. How can we improve the quality of life? Not just the lifespan and also the health span, and how patient can feel a lot better with the whole treatment. It's not just looking at the number to decrease the AHI. So I think AI will really help us in this regard.
Fantastic. No, thanks a lot, Dr. Chui. I completely agree with you on this. I mean, everybody's getting so much data from all these different devices, wearables, and so on and so forth. But this data is extremely unorganized, unstructured. And if AI can sanitize the data, make sense out of it for the physicians who are extremely busy, or for the patients who just don't understand all this data, then it becomes a useful data for the medical professionals. And also, if you could figure out a more customized treatment plan based on the AI models, based on AI recommendations, then that's even better. Now, thanks a lot, Dr. Chui. And for the next question, I would request everybody to sort of share their perspective. But we all talk about long-term health benefits. We all talk about chronic disease management, or having a good lifespan, and so on and so forth. And there are various factors that impact the long-term health and good lifespan. But what do you think about sleep apnea? How diagnosing sleep apnea earlier really help with the long-term health? And I'm opening this question for everybody on the floor. But I see Lydia is already unmuted herself. Lydia, did you want to start?
Yeah, indeed. We are working very closely with different specialists,
Right.
and how to integrating the sleep data in their holistic management for chronic disease patient, especially as we have mentioned, is especially hypertension patient, patient with cardiovascular disease, post-stroke, diabetes. Because we do see people who monitoring their sleep at the same time, then they can have better treatment. Okay. And for example, we do recently work with cardiologists who told us that, we figure out that when the patient have arrhythmia, and after the surgery, it comes back maybe 6 or 9 months later. And finally, they figure out that in these two patients are not tested for OSA. And with the treatment of the OSA, they do find that the reoccurrence of the arrhythmia do reduce very significantly. And that's how we would like to bring into the cardiologists as well, is how to use a handy HST, and such that they can at the same time not only helping the patient, but also help them to ramp up and others special service for their patient, and to take care of the patient in even more professional and also proper way. Yeah.
Thank you. Thanks a lot, Lydia. May I request Dr. Lee to go next, please?
Yeah, so I think a lot of people does not understand that we spend 1/3 of our life sleeping. So in this 1/3 of your life, if you don't sort it out well, right, the other 2/3 is going to be affected. And while we do recognize, patient who has problems, if like a respiratory physician like me, if the patient cough out blood, yes, we know that that's important. When the patient is wheezing, when the patient is breathless, yes, something is wrong. But when a patient is snoring in the sleep, sometimes they sleep alone, nobody can ever tell them about that. So this is where all the wearables come in, and we can detect patients who have problems during sleep. And now the how patient present to me has changed so much that probably 1/3 of them come because wearable tells them there's something wrong with their sleep, right? So this 1/3, in this 1/3 of your life, that we have to identify, is there any problems? Because eventually it's going to inflict harm upon the other 2/3 if it's not well treated. And definitely when it comes to sleep apnea, obstructive sleep apnea, we keep harping on it. And we know that sleep medicine is not just obstructive sleep apnea. But the reason why we keep harping on it is because it's so prevalent, and 90% of the patients are not aware that they have it. This is in Singapore, and I suppose it's the same worldwide as well. Yeah, so we have to pick these low-lying fruits, and we have to treat it well. Yeah, and we know that untreated sleep apnea can cause a lot of problem when it comes to heart, metabolism, brain, mood, aging itself. And all this are new knowledge, because if we look at the field of sleep medicine, we are probably only 50, 60 years old, compared to the rest of medicine. So even doctors themselves may be ignorant of obstructive sleep apnea, which is why, interestingly, the majority of my patients are actually doctors. Yeah. So they're the first one to know and the first one to seek treatment for it. And that's how they cascade the knowledge down. And I think one thing when it comes to just backtrack a bit with regards to AI is what we also mustn't forget that is that AI is just not a clinical tool just for doctors. It's also quite powerful when it comes to public education.
Right.
In a very simple example, snoring has always been seen as something that is normal. It's like grandmother always tells the grandchildren, if you snore, it means that you have a very hard time during work and it's normal to snore. So in the past, you want to correct this kind of misconception, you will need to go through, you need to create a deck of slides, it takes you days and months to create it, and then you give a public lecture. But now with AI, within 5 seconds, I can get my slides and I can deliver the message. So that's one way for public education, for health literacy, using AI to teach about this 1/3 of your life. I think this is very important, and this has a major effect when it comes to increasing literacy, not only of public, but also of fellow professionals. Now, the next thing to talk about AI is health economics. A lot of times, whatever we do pretty much also depends on whether the insurers are paying for it. And when it comes to insurer, we need to have certain value-based outcomes so that we can convince them that, yeah, this is worth paying for. And with AI, we can aggregate information, we can aggregate data so easy. We don't have to go through Excel files, just to throw all the data, and we can actually just throw everything into AI and the data comes out nice, and we can show it, the data black and white, to the insurers to convince them, yes, outcome changes, patients are less sleepy, your employees are more productive, and hence they're more willing to fund treatment and diagnosis of a sleep disorder.
Fantastic. So what you're saying is that insurance companies may not like uses of AI so much because ultimately they have to pay the money to the employers and to the patients. Thanks a lot, Dr. Lee. Dr. Saini and Dr. Chui, what do you think about the impact on the long-term health because of diagnosing the sleep apnea earlier?
I'll go first, I guess. I think, uh, apart from what's already been said, um, especially in the societies where people are living longer and longer and longer, cognitive health has, become a great topic of discussion.
Right.
And there are more and more people who are being diagnosed with cognitive impairment, dementia, and all of these neurological conditions. They're in some way also linked to their sleep health. So Dr. Peng mentioned, hey, you're sleeping 1/3 of your life, and we need to look at that. And that's a perfect example where it's going to impact your functioning. People used to die in their 40s, 50s. No one ever lived into 80s, 90s. And now suddenly we have the whole shift in the aging population. And so now people have to figure out, what am I going to be doing in my last 30 years of life? Where I may not be bombarded Or they may be actually, I mean, look at all the presidents and all the senators and all the congressmen. If you look at their average age, they need to be on top of their game, right? And so you're seeing not just physicians working into late lives, but pretty much every profession I see these days. People are living longer, working longer, so they need to be on top of their game longer, right? So you can't be having memory loss just from the sleep loss, or you didn't tackle your sleep apnea. So there's a lot of discussion and buzz around that. And a lot of people are honestly scared of dementia. No one wants to get diagnosed with dementia. I have physician patients. I have very high performing individuals who've already achieved so much in their lives. And they're really, really scared when they look at the proposition that, oh my gosh, I might end up getting diagnosed with this, or it's gonna, that's not something that folks who are in their 70s, 80s take lightly. So then you have to be aggressive in the treatments, in the diagnosis. And when I started my career, uh, I was under the impression that, hey, it's going to make the most impact when you're in your 40s, 50s, right? Because we're looking at your heart health, reducing your heart disease risk, reducing your stroke risk. But now, when I look at the aging population, that's really where the most benefits are. Because one, time is of essence, right? I only have 10, 15 years of life ahead of me. And so I want to live the best years of my life during those decades. And sleep quality is actually pretty much at the top of
Yeah.
their list. And if you don't have good sleep quality, you don't have good life, basically.
Wow. That's pretty deep. I have been, let me make this disclaimer. I have been snoring for almost 20 years now, and I never, thought so much about it. But now I have to think about it. But I hope we don't get banned for mentioning congressman and congresswoman in this conversation. But thanks a lot, Dr. Saini. Dr. Chui, anything from your side on the long-term health?
Well, when you asked about how's diagnosing sleep apnea earlier, how can help improve long-term health, nothing will improve if there's no treatments. You can diagnose all day long. The most important thing is how are the healthcare providers using these important numbers and data to come up with the treatment plan now. There's not going to be one treatment for all. There's something that we work really, really closely with other physicians at the government level because at the VA we are sharing the same EMR. We can see everybody's work. We can talk to anybody anytime. And that's a really important part is how can we utilize the numbers that have bombarding to us in a very simple way. So that's why you can say, oh, we use a lot of combination therapy. We can use CPAP we can significantly decrease the pressure when the jaw is aligned, where airways are a lot open, a lot more relaxed, then you can kind of take the best of both worlds and eliminate the side effects of both worlds. So you can decrease the pressure and what the jaw is help it open not too much in the forward positions. And something that I think really important is do not underestimate the power of central nervous system, how this affect sleep and how we can feel better. It's not just for lifespan, but it's also health span and quality of life. In the treatments of TMJ treatments or the sleep treatment, when combine everything together, simply we just put something like we use it for that generations in medicine using PRP, which is the platelet regenerative medicine side. We put the platelet inside the Georgian when someone have a lot of damage, the Georgian because of grinding and all that. We know that improve the AHI just for that. And how can we do that and treat the patient's sleep and combine everything together? Especially important in the veteran side because this helps a lot of patients with depressions and PTSD. Now, medicine right now, all these treatment options only primary based on medications. But people don't understand this. A lot of antidepressants come with a really, really bad side effects. These are really good medicine, but the side effect is significantly increased teeth grinding. That causes a lot more problems to make the symptoms worse. Potentially we suspect that antidepressant can increase teeth grinding, that you can increase the AHI as well. So all these are rely on all these objective data. How
Is it Dr. Chui's network?
Should be, yeah.
Okay. I thought it was my network.
No.
Okay. So let him come back. Okay, so I know we are on top of the hour, but let me request each and every panelist to share just one insight, one sort of key takeaway, one final comment that you want to make about this topic. And I may be putting you on spot, but Dr. Saini, could you please share one final key takeaway or comment on this topic?
Actually, I'll give you two. How about that? I think the number one, these are powerful devices, and there is a lot of data and knowledge to be had from testing. I also think because how the usage has been growing in various different, pathways and workflows, different specialties. So it needs to, I think what we need as a field is to have some, we know it performs really great when I'm diagnosing someone who's not on treatment. Someone, for example, you mentioned, hey, I've been snoring. So yes, you've never been tested, you've never been treated, and there's a perfect case for you to get a Belun test done. But then there is equally strong case that we're seeing in the field where we're using these testing to look at the effectiveness of therapies, whether it's CPAP therapy, whether it's dental therapy, whether it's implant therapy. We need, I think, maybe these studies already exist, but we need validation studies so that as a clinician, I have more faith when I look at that data and it's telling me that, hey, sleep apnea number is still pretty high, even though the CPAP says sleep apnea number is good. So then how do I resolve that conflict? And I think there has to be studies done by Belun and others to prove that, hey, this is a valid data, that you should have X amount of confidence in this data. I think that will help expand the reach of this device way, way more than where we're at now.
Sure. Thank you, Dr. Saini, for this thoughtful takeaway. Appreciate that. Dr. Lee, please, one final takeaway from your side.
Yeah, I think with Belun coming up with a consumer level screening device, I think that would be perfect. It completes the entire spectrum from screening to diagnosis and then, of course, follow-up treatment. So look forward to that. And of course, yeah, if there can be a disposable type of device when it comes to a diagnostic device, that would be perfect as well.
Actually,
Fantastic.
I beg to differ. We don't like disposable device. I think that creates too much medical waste, and there's just not enough chips in the world. If you're sitting in Hong Kong and you have all the raw material, but everywhere else in the world, these chips are in very short supply.
We cannot talk about politics over here, but yeah, I understand. Thank you, Dr. Saini. Lydia, one final key takeaway from your side.
Yeah, I think sleep, as all the experts has mentioned, is a very good growing field. And we very focused on medical grade. Even we provide consumer version in the long run. But we do work with different expertise and to see how everyone can make use of the medical wearable and AI to have a better life and better lifespan. Yeah.
Thank you. Thanks a lot, Lydia. Dr. Chui, one final takeaway before we wrap up. Dr. Chui.
I just think it's very, very important all the specialties to work together to tackle this really nasty medicine problem in the world right now. We have the tools. We just have to be open-minded to all work together, because sleep does not belong to just one specialty. It belongs to the whole medicine and dentistry side.
Fantastic. So your point is that all the departments have to work together.
Yeah.
So again, a lot of education is needed for our friends in nephrology, oncology, cardiology departments. Obviously, dentistry department is already way ahead in this space. But again, thanks a lot, all the panelists. If I may wrap up, the sleep testing landscape has evolved. It has shifted from costly capacity constraint in lab PSG to wearable HST devices, dramatically reducing wait time, previously from 12 to 18 months to now a couple of hours, cost and patient barriers. Global scale of the problem, almost 1 billion people worldwide have sleep apnea. Their spouses know about it, but probably they don't know about it. They don't want to accept it. 90% undiagnosed, making scalable testing solution extremely critical. Wearable HST advantages, devices like Belun Ring enable multi-night testing in the patient's natural sleep environment, improving comfort and allowing rapid AI-generated reports for both diagnosis and post-treatment monitoring. When it comes to multidisciplinary collaboration, it's extremely important. Dentists are uniquely positioned to screen for OSA through regular patient visits and can identify anatomical risk factors. Cardiologists and nephrologists represent key growth areas for OSA screening with significant overlap in patient popularities. And probably Lydia's eyes must be shining to see that interesting opportunity in other sectors as well. A bidirectional referral loop between physicians and dentists from the foundation of effective OSA care could be extremely critical. AI as a force multiplier, AI definitely accelerates data analysis, supports personalized treatment planning, improves patient education, and can aggregate outcome data to support insurance reimbursements. Long-term health impact, obviously, untreated sleep apnea is linked to cardiovascular disease, metabolic disorders, cognitive decline, dementia, mood disorders, and multiple other issues, making early diagnosis critical for health span, not just lifespan. And it's not only early diagnosis, but also the early treatment, as our panelists have mentioned. Looking ahead, Belun is developing a simplified consumer-level version of its ring for broader accessibility. Thanks a lot, Dr. Saini and Dr. Lee, for hinting towards that. And validation studies comparing wearable HST data, aging CPAP machine data are needed to further expand critical confidence. Again, really appreciate all these insightful perspectives today. I'm sure that the medical professionals, the medical students who are going to listen to this conversation are going to get quite a lot from this conversation. And also because the panelists are representing different geographies, different experiences, different fields, which makes this conversation even more interesting. Again, thanks everybody for your time. Really appreciate it. And I hope that we can keep collaborating, keep coming together to have such interesting dialogues and conversations. Thank you. Thank you very much.
Thank you.
Thank you.
Thank you.
Bye. Thank you.
Bye.